Thank all of you for giving this opportunity. I am extremely thankful to Dr. Raja Karnam that he chose me to give the first memorial lecture in honor of my classmate, Dr. Nirmala. She is a very good friend. I have known her for the past 60-some years. Always calm, quiet demeanor, and we enjoyed meeting each other again during our alumni meetings. The most recent one was a couple of years ago. I bring to you greetings from the batch of 1962, the most cohesive group of GMC alumni. I spent quite a bit of time roaming around the campus and sitting on the benches, smoking a cigarette, and running away when the principal came. At the time it was Dr. DJ Reddy Garu, who is a legend by himself. I am a radiologist by profession. After retiring from radiology in 2020, after 50 years of practice, it dawned on me that I didn't do much good to the society or many of my patients. I thought we are not addressing the root cause of our diseases. Then I came across a specialty called lifestyle medicine and lifestyle modification, which I believe is probably the most important thing we can do for ourselves, for our patients, family, our community, our country, and globally. Probably I won't tell you anything that most of you don't know. Most of you are well knowledgeable about what I'm going to say, but I will try to put it in a different perspective of what the discussion is all about. I would like to complete in about 50 minutes so that we can have enough time to entertain any questions that you might have. Please do remind me, madam, about 10 minutes before I need to finish so that I can wrap it up. Is that okay with you? Yes. Okay, thank you. Let's get started. What is health span? In India, now the longevity is 70.2 years. Means the average person that is going to be born today, the average person is going to live for 70 years. It is the time from birth to death. That is the lifespan. The health span is number of years that somebody lives in a healthy state, fully functional, meaning be able to eat, go able to go to the bathroom, knows his family, his friends, and walk around the house, get into the car, functional. There is a gap of 10 years between lifespan and health span, meaning the average person spends 10 years of his or her life not being fully functional, which is not a good thing. Again, in between sometime, please be ready to answer them in chorus. Lifestyle medicine is defined as a discipline of medicine whereby habits and practices, what we call dinacharya, that can impact the prevention of chronic diseases and the reversal of chronic diseases that might occur, that will occur because of bad habits. Doing things that we should not do and not doing things that we should do. What is lifestyle? A group of people living in a particular place for a period will develop their way of life. This is also called their culture. Culture varies from time to time and place to place. As I just said, I used to smoke in front of the Thinker statue. At that time, that was okay. Now it's not okay, I think, because you can't smoke in public place anymore. We used to eat breakfast, morning snack, lunch, afternoon snack, and supper. I was told now it has come down to 4 or 5, not 6 or 7 a day. So culture changes from time to time and place to place. Culture of GMC, we were told at the time, is different than the culture of RMC, Rangaraya Medical College. Culture of RMC was different than Karnool Medical College, because when the geography changes, the culture changes. If you go to Gujarat, they eat a sweet for breakfast. So their culture is different. This doesn't mean one is better than the other. It just shows culture varies from place to place and time to time. In Kerala, there is a lot of coconut oil. Here we use different oils. Different cultures will lead to different diseases. I have to make some declaration. I told you I was a smoker prior to 1979. I was a non-vegetarian prior to 1979. After realizing that I am not leading a good life, in 2022 I started walking. In 2022 I walked an average of 6 miles. In 2021 average of 7 miles. Not per year, per day. I meditate daily. I am a devotee of Swami Chinmayananda. I am a student of Vedanta. I am a vegetarian. And I have no conflicts to declare. I practice yoga daily. Now, how do we practice present-day medicine? A typical patient comes to our patient, either tummy ache, or chest pain, shortness of breath, or pain someplace. First thing we do is take a blood pressure. We realize he has hypertension, we give him a pill, which is the right thing to do. Then we test the blood sugar and hemoglobin A1C. We find out that he is a diabetic, he or she, we give a pill. Then we do the chemistry profile, the cholesterol is high, HDL is low, LDL is high, we give a statin. Then he says, sir, I'm also having a pain in the right knee and left hip. We give a pill for the pain. Then we give a PPI because the pill you gave might irritate the stomach. Then we raise, he gets occasional angina, so we refer him to a cardiologist, give him another pill. He says, I'm depressed because my husband died or my son died, we give him another pill. The more pills we give, the more side effects there are. So we practice the pill medicine day in and day out. This is true of each and every doctor in India and the US. We are no exception. That's what we are taught to do. That's what we do very faithfully and honestly. Isn't that true? True or not? Yes. Hello? True? Yes, thank you. In the US, the blue graph shows the number of prescriptions that are filled in a year. The average American gets 12 prescriptions per year. I suspect Bhagat is no exception to it because of the pill medicine that we are practicing. In the US, we spend $350 billion, the whole budget of India. It is not sustainable. It is not good in the long term. The pill medicine has to change. Please pay attention to this. If there is a faucet that's spilling water, what do? You keep mopping it every hour, every day, or is it better to turn the faucet off? It's common sense, isn't it? We need to turn the faucet off. Pill medicine is mopping it every day. Lifestyle medicine is turning the faucet off so the water won't leak anymore. This quote was attributed well enough. If you sit in a lecture, after your professor teaches you for a whole hour, if she or he did not make it simple, means he didn't know it well enough, and are you maintaining proper weight? Do you smoke? Are you stressed? Are you sleeping well? Do you have purpose in life other than Gana Pena Bajana? If you do these 7 things right, you are practicing lifestyle medicine. Simple enough? Is it simple? Hello, is it simple enough? Very good. This is choice between joyful living and fearful death. Those 7 things: eat well, move more, love more, be stress-free, have a purpose in life, and don't smoke. Simple enough? Albert Einstein said that's simple enough. In detail, what these all mean to you. Show some evidence. Each and every statement I make is based on evidence and based on randomized clinical trials. There is sound biochemical evidence of the changes that take place in the body when we follow these 7 principles. What are the 7? Good. Eat well, move more, stress-free, don't smoke, exercise, purpose in life. Good. This keeps coming. By the time you go, you'll be expert in lifestyle medicine. All right? What would happen if everybody in Guntur district or Andhra Pradesh didn't smoke, ate a healthy diet, exercise at least 30 minutes a day, which is not too much. That's what we spend watching TV or reading a newspaper. 30 minutes a day of exercise. Maintains a healthy body weight of 25 kilograms per meter square of BMI. How many of you know what BMI is? Body mass index? Oh, good. Very of you know. Excellent. Very good. Maintaining a normal BMI of less than 25. Exercise, not smoking, eat a healthy diet, and don't drink too much. Guess what would happen if all of us do that? There will be 78% lower risk of any chronic disease, diabetes, hypertension, heart disease, arthritis, dementia. Chronic, 78% decrease in the incidence of chronic diseases, just by doing the simple 5 or 6 things. 93% lower risk of diabetes, 81% lower risk of cardiovascular disease, 50% lower risk of stroke, 35% lower risk of cancer. We can live average of 12 to 14 years longer. This is from the New England Journal of Medicine. I'm not giving references to all of them. I'm giving a reference to some of the articles which are really staggering. This is from New England Journal of Medicine, year 2000. Just by not doing the 5 things, or doing the right thing, not doing the wrong thing, this is the effect. How many pills we have to take to achieve this? There is no pill that can do all of this. What happens when you don't do things right? There is a dysregulation of the microbiome. For some of you, this may be new term. How many of you heard the name microbiome? 1. Okay, I will be elaborating on this. There are some epigenetic changes that take place. How many of you heard the term epigene? It is a Harper biochemistry book. I know so because I have looked it up recently, a couple of years ago. Okay. There will be cellular stress and injury and many chronic diseases. What percentage of the population follow these 5 simple things? What are the 5 simple things again? Eat well, move more, stress-free, don't smoke, exercise, a purpose in life. What percentage do you think practice these 5 things? Any guess? How much?
10.
3%. Hello? Only 3% of us do those simple things. Now you know how important lifestyle medicine and lifestyle modification is. Can lifestyle modification reverse diseases? The answer is absolutely yes. It can prevent disease. It can alter disease. Can you hear me? Okay. It can prevent disease, it can reverse disease. Let me show you some examples before I go into the subject matter. Do you know what this is? This is coronary angiogram. They're the blood vessels in the heart. Those of you cannot see. This is the left anterior-descending artery. This is a diseased vessel with more than 50 to 60% stenosis. Without medications, after 3 years, this is the vessel. Did the diseased vessel get better? Yes or no? Yes. No statins, no bypass. Just by change of lifestyle. You don't have to take pictures. I will leave the PowerPoint here. You are most welcome to have it. All of you. And spread the word. Don't keep it a secret. Oh, sorry. This black area is a non-perfused area on a PET scan. This is after 5 years of practicing lifestyle medicine, there is a reversal of the disease. There is perfusion of the heart which is much better than what it was. This is from Dr. Arnish in Jam. No medications, no surgery, no stenting. Reversal of the heart disease by lifestyle medicine. This is a pictorial representation of that. I showed you one example that lifestyle modification can reverse heart disease. Now the question is, can it reverse cancer? The answer is yes. This is from Journal of Urology, 2005. It's the PSA in a patient with prostate cancer. This is the control group. This is the study group. Those that practice lifestyle modification, the PSA went down, means cancer is getting better. In the control group, PSA is going up, means the cancer is not under control. This is not just one patient, this is a group of patients from Journal of Urology in 2005. So this is not new, except that nobody talks about it. You know why? We don't make money doing lifestyle medicine. We make money prescribing pills. Pill medicine will get rich. Lifestyle medicine patients get better. The change in the PSA is directly proportional to the extent or severity of modification of a lifestyle. Here, control group, intermediate intensity, severe intensity, means walking more, eating healthy food, being a vegetarian, PSA went down. So the reversal is proportional to the dose of lifestyle medicine that we practice. This again another example of how much the PSA has gone down. This is the MRI of the prostate. This is the cancer baseline. After change of lifestyle modification, the cancer has gone to small. So this is a reversal of prostate cancer just by change of lifestyle. Please, I'm not saying that prostate cancer can be cured by lifestyle change. It contributes to the decrease of the tumor recurrence. It is not a stand-alone treatment by itself. It has to be combined with surgery and or radiation or chemotherapy or whatever it might be. How does it happen? It does by changing genetic changes. Here the disease-producing genes are in red, disease-fighting genes are in green. With the change of lifestyle, the disease-producing genes are turned off and the disease-protecting genes are turned on. Red is turned on, green is turned off. So genetic changes take place with the lifestyle modification. Longer the telomere, longer you live, is beyond ruled out. Nobel Prize was awarded to Dr. Blackburn for proving this in the lab. With exercise and lifestyle modification, the telomere and telomerase, they increase in activity. How many doctors will tell you if you take this pill, you will live 1 year longer? Nobody. Because such a pill does not exist. But this does exist. If you do these 5 things right, you know what they are right. The telomerase will increase, telomere becomes longer, and you will live longer. That is about the reversal of a disease. Can lifestyle modification prevent a disease? The answer is absolutely yes. This is from, I can't read it very well, you can read it from 2002, I believe, the metformin trial, placebo, metformin, lifestyle modification. With placebo, chance of you becoming a diabetic is close to 30-some%. With metformin, it is 20-some%. Just with lifestyle change, it is less than 15%. The 50% reduction in the incidence of diabetes in those that follow lifestyle medicine and those that modify their lifestyle. This is a multinational trial of thousands of patients which proved beyond reasonable doubt that exercise, proper nutrition, stress-free life, not smoking, have a purpose in life, and sleeping well will decrease the incidence of diabetes by 50%, 50. You know, India is the diabetes capital of the world. Somebody made a cartoon, India has a sugar bomb in the making. Let's talk about the food first. Food as medicine. Food is medicine. If you don't take food as medicine, medicine will become our food. Means you have to take breakfast medicine, lunch medicine, supper medicine. Aharam, aushadam. Aharam can also be visham. If you eat the right things at the right time and the right quantity, it is aushadam. If you eat inappropriate things, inappropriate time, inappropriate quantity, that becomes a visham. Visham kills, aushadam saves. Correct? What should we eat? This is what my grandma told me, your grandmother would have told you if you were still alive. Nutrition is responsible for 7 out of 10 leading causes of death. I will tell you what they are. Heart disease, cancer, diabetes, hypertension. Very difficult to do, very easy to understand. I always say lifestyle medicine is easy to teach, easier to understand, very difficult to follow. There is a big intentional behavior gap. Eating fruits, eating vegetables and whole grains, unprocessed as much as possible. I'm not preaching you to become a vegetarian, but I'm giving you scientific facts. Red meat is probably carcinogenic, according to the American Cancer Society. Processed meat is carcinogenic. Non-vegetarians, there is higher incidence of diabetes, hypertension and heart disease. They're very clear. This is attributed to Hippocrates. Just as food causes chronic disease, it can be the most powerful cure. This is attributable to Hippocrates. Hundreds of years ago, he is telling, please practice lifestyle change. So lifestyle medicine is not new. He also said, illnesses do not come upon us out of the blue. They develop from small daily sins, meaning not doing things that we should do and doing things that we should not do. When enough sins have accumulated, illnesses appear suddenly. Diabetes, hypertension, heart disease, cancer, on and on and on. Just because we are not doing the right thing. He called it sin. So if you want to argue, you can argue with him, not me. Of course, many of you heard this. Cure sometimes, relief often, comfort always. Lifestyle medicine does just that. Nutrition, going back to that, what we eat, how much do we eat, and how often do we eat? When you eat too much, when you exercise less, there is a positive caloric balance and you gain weight. The normal BMI should be less than 25. We become overweight, obese, and very obese. Obesity has increased in the last 20 years by 40% in the US. Obesity and overweight is 70% in the US and about 40% in India. So we're not doing that bad, but we're getting there because we're getting used to Western culture, Western atmosphere, Western habits, pizza, cheese, macaroni. We buy them on Amazon, they're all available. There is a project called DASH, D-A-S-H. There's a dietary approach to stop hypertension from American College of Cardiology and American Heart Association. There's a diet. This is the first method of approach to treat hypertension is by modification of the diet. Yet, less than 20% of the population that are hypertensive follow the DASH diet. It is cheap, it is free, they don't do it. Less than 30% of us consume enough vegetables and fruits. What do we eat? We literally eat crap. You know what crap stands for? Calorie rich and processed food. Any food that is packaged, that has a barcode, has a label on the back, is probably crap. That's what we buy when we go to any of the supermarkets. This is not the way this used to be. Anything white is almost always bad. Sugar, maida, dalda, salt, and white dash, white man. Is the food that we are eating compatible with our genes? I would like to present to you that it is not compatible with our genes. Our genes are at least 2 million years old, if not longer. That is the hunter-gatherer age, the Paleolithic age, or the Stone Age. How often do you think our great-grandfathers who came from the Stone Age ate? Did they kill a rabbit for breakfast, a deer for lunch, and a pig for a snack, and a goat for dinner? No. They hunted when they are hungry, and they ate. They walked to the next station, and the 10 miles, 20 miles, whatever the distance, they halted there. Again, when they felt hungry, they hunted again and they ate. So they ate only when they are hungry. They didn't eat morning tea before brushing the teeth or coffee, breakfast. As soon as you come to the hospital, go to the cafeteria with the friends, with the strap on the neck, one more cup of tea, then go to the class, lunch, snack, dinner, and midnight tea because we would study hard. Our great-grandfathers did not do that. They were in a Paleolithic age or Stone Age. They ate only when they felt hungry. The last bullet, please. The glycemic index of the food has changed over the past 200 years after the so-called industrial revolution. Major genetic changes occurred more than 12,000 years ago. There's approximately 600 generations ago. There's no change in genes after that. But our food has changed. It means our genes are not compatible with our food that we eat. That's why we have the insulin resistance, metabolic syndrome, weight gain, obesity, heart disease, diabetes, hypertension, cancer. With the domestication of the plants and animals, the yield has tremendously improved and we're eating more. Again, I said this already. Well, India did a lot of good to the world. Yoga started in India. Meditation started in India. We also did a lot of bad. Sugar was invented in India 2,500 years ago. That is our negative contribution to the rest of the world. See the sugar consumption. It went on from 1820 with their consuming less than 5 pounds per year. Now we are consuming 150 pounds of sugar per year. All this is part of crap that we eat. Calorie rich and processed food. Obesity is going parallel with the increase in the calories that we consume. Per capita meat consumption. I don't have the data for India. I presume they're running parallel but slightly at a lower plane. The average American consumes about 1 pound of meat per day. At least 75% of it. There's a lot of meat. Meat is carcinogenic. Cheese consumption, thanks to the pizza and the hamburger, is going up straight line, 30 pounds per year. This again is data from the US. We are nowhere near that bad, I don't believe. Obesity is a pandemic. As I said, 70% of Americans are either overweight or obese, and 30% of Indians are either overweight or obese. It has a global economic impact of $2 trillion, which is 7 times the Indian budget. 111,000 deaths are attributable directly to obesity. It is still going up, straight line. So BMI, you are all familiar with it. Normal BMI is 18.5 to 24.9. Then you have overweight, obesity class 1, class 2 and class 3. We should keep the BMI in the normal range, except in the last few years, there is evidence that elderly population, that is of my age, more than 70 years of age, are better off with the BMI between 25 and 28. There is evidence of that. Means they will be able to cope up with the diseases much better if they are slightly overweight after the age of 70. The reasons attributed are, one of them is that they have a cushion effect, the body fat and lean muscle. When they fall, they don't fracture that easily. And also when they get a state of a catabolic state, they can cope up with it slightly longer. So there is some evidence evolving that elderly population are better off with a slightly higher BMI than the normal range. There are some alternatives to BMI. There is the waist to hip ratio, weight to height ratio, skin folds, waist circumference and all that. Please do look it up. Those of you that are doing medicine post-graduation, there are alternatives to BMI. BMI started some 600 some years ago. It is mostly based on the European population and Caucasians, which is not necessarily equally applicable to the Indian population. I think I already covered this. Elderly population between 24 to 29. Those that are less than 22 and more than 32 have a higher risk of cancer even in the elderly population. So far that is about nutrition. You cannot lose weight just by exercise. Let me categorically state that. If you really want to lose weight, you must control nutrition as well as calorie expenditure. With physical activity, you will be lucky if you lost 1 or 2% of the weight. But with the control of the diet, sizes and what you eat, one can lose weight if one is overweight and are obese. The recommended exercise is 10,000 steps per day. That is approximately 4 miles per day. You need to produce a calorie deficit to lose weight. If one is overweight or obese, you need to produce a calorie deficit of at least 800 calories per day. If you are extremely obese, you need to produce a calorie deficit of 1200 calories per day. Last bullet, please remember that. If you consume 500 less calories per day, you will lose 1 pound per week. Means in 1 year, you will lose about 10 kilograms. If you consume 500 less calories or spend 500 more calories with exercise. Overweight and obesity are attributable to consumption of sugar and sugar substitutes. Don't be lulled into thinking that a diet Coke, diet Pepsi are healthy. They lead to cancer, they don't make you lose weight. There is increased incidence of cardiovascular disease, diabetes, hypertension and stroke in those that take sugar substitutes. Chronic diseases. Most of the money we spend for healthcare globally and in India is to treat chronic diseases. 60% of Americans and 40% of Indians have a chronic disease. And 40% have more than 2 chronic diseases. 38% of us will be diagnosed with cancer, 50% will have heart disease, 30% of Americans are diabetic, and 11% are pre-diabetic, 11% are diabetic, and 99% of the pre-diabetic don't know that they are pre-diabetic. In India, the incidence is about 11%. Diabetic with a lot of geographic variance. This again a different slide, different format, the chronic disease attributable to the lifestyle that we have. Eating too much, the wrong foods, not exercising, not sleeping, lot of stress, smoking, no purpose in life. If you do all of these, the chronic diseases will be reversed. Again, same thing, excess alcohol, inactivity or sedentary life, depression, not sleeping, overeating, obesity. Obesity leads to metabolic inflammation. Metabolic inflammation leads to, please pay attention to this, students. This is a very, very important concept. All the chronic diseases have a common etiology, including cancer, hypertension, diabetes, obesity, metabolic syndrome, insulin resistance. They are all due to chronic inflammation in the body. I will dwell on that in a minute. Chronic inflammation leads to insulin resistance, diabetes, daily habits lead to chronic inflammation. Chronic inflammation leads to chronic diseases. We covered this earlier. Microbiome, epigene, and cellular stress. They all lead to chronic inflammation. Chronic inflammation leads to chronic diseases. Obesity, diabetes, cancer, dementia, depression, etc., etc. Body considers excess fat as a foreign body, is a foreign invader, invoking chronic inflammation. Anybody radiologist here? Radiology PG? None, okay. When we do a PET scan, all the fat lights up. It's called a metabolically active fat. That is inflammatory fat. We did not realize this 5 years ago. I was wondering, it's a normal phenomena. We see it normally, but it lights up like a light bulb. The metabolically active inflamed fat. That's what we call brown fat in MRI. Again, saturated fats, omega-6 fatty acids, they all lead to chronic inflammation. Again, different slide, same message. Lifestyle-induced diseases lead to chronic diseases, heart disease, stroke, diabetes, obesity, metabolic syndrome, etc., etc. In the US, we spend $4 trillion for healthcare. That is $12,000 per year for each American, child, adult, man, woman. That is approximately, 10 lakhs per year. 85% of this is attributable to the treatment of chronic diseases. Most of them are modifiable, are preventable, are reversible by change in lifestyle. This again our expenditure cost. Okay, number 1 killer of heart disease is heart disease, the cancer, accidents, respiratory diseases, Alzheimer's, diabetes, all these can be modified by lifestyle change. One might ask, how can you prevent the accident by lifestyle change? Cognition, dementia, alcoholism are the common causes of auto accidents. How did we get here? Food advertising. You can see when you go on the main road overbridge, what all you see, the restaurants, advertisements, and the doctors. Oversized portions, genetics, and we eat more than what we spend. Okay, let's talk about microbiota. This is a new area of research in healthcare. There are approximately 30 trillion cells in our human body. True? That's correct. Somebody may say 40, somebody may say 35. This is generally accepted number. There are 100 trillion, 3 times as many bacteria in our body. On the skin, in the nose, in the eye, most of them are in the gastrointestinal tract. That's called the microbiota. There is a symbiotic relationship between the bacteria in the gut and our health. Let me repeat. The bacteria in the gut determines your physical and mental health. Depressed patients have different microbiota than those that are not depressed. Obese people have different microbiota than lean people. Separating those 100 trillion bacteria and viruses in us is a single layer of epithelium in the gut. Any disturbance in that is going to change the homeostasis of our body. A high-fat diet disturbs microbiota. There are mainly 2 types of bacteria, the Firmicutes and bacteroides. If the Firmicutes go up, it's not good for you. With a high-fat diet, Firmicutes go up. Normally, large intestine does not participate in absorbing or digesting the food, correct? Most of it is stomach and small intestine. But when the Firmicutes is high, lipopolysaccharides, complex carbohydrates are digested in the large intestine. They are converted to fatty acids and are absorbed. It is a vicious cycle. The more the proteins you consume, more the Firmicutes, then more the absorption of fat. So once the slippery slope starts, we have a problem. Again, poor diet, dysbiosis of the bacteria, activation of the immune system, and prostaglandins and serotonin are disturbed, you get depression. And I will cover this. Babies born with a C-section have a different microbiota than the babies born out of vaginal delivery. You know what that means? The baby gets the bacteria the minute she is born from the anal canal and the vagina of the mother. Those in the C-section have different kind of microflora. There is increased incidence of autism in the kids born of C-section. Part of that may be attributable to the change of microbiota. This again, area of active research. At least the question was raised, it will be answered soon. Is autism related to the microbiota in the gut? I'll give you a minute to read that. There is a gut-brain axis. There is a bile of those bacteria. It is a slippery slope. Microbiota has a role to play in many of the chronic diseases. Diabetes, inflammatory bowel disease, depression. Play the cards you get with ABG. Got it? Somebody may have good cards, can still lose. True? Somebody can have bad cards, he can still win the game. How skillfully you play the game. Having a diabetic gene is bad card. But playing your life right, you can win the game and not become a diabetic. I don't think you guys can. Let me give a different example. The light is the gene. The switch is the epigene. Will the light come on until you turn the switch on? Hello? No? If you don't turn the switch on, the light doesn't come on. Even if you have a obesity gene, hypertensive gene, diabetic gene, or cancer gene, you can keep the switch turned off. The disease does not have to manifest in you. So don't blame the parents when you become a diabetic. They gave you a recessive gene, but they did not ask you to become a diabetic. This may be a surprise to some of you. 99% of our human genome is common to all human beings, from Einstein to an idiot. Same genes. But how you lead your life determines the manifestation of the good gene or the bad gene, or successful gene or a gene of a failure. All the differences we have, different shapes and colors and sizes, mental capacity, less than 1% of the genome. Remember, there are only 25,000 genes in the body. So the difference is less than 50 of them. Epigenetics is the study of how cells control the genetic expression. Gene is controlled by lifestyle, behavior, and environment. The more the pollution, the worse off we are. Epi means above. I don't have to tell you that. Epigenes control the gene. Epigene is the telomere and the telomerase that I talked about. We are not victims of our genes, we are the determinants of our destiny by our daily behavior. Okay, I'm going to rush through this. There are 25,000 genes. Elizabeth Blackburn from Stanford University was given a Nobel Prize for documenting that the epigene does exist, and epigene controls the gene, and the epigene can be controlled by our free will. This is prarabdha versus purushartha. The cards you get is prarabdha. How well you playing cards is purushartha. I think I will go through this very quickly. All of us do not absorb the food equally. Two people in the same quantity, one person will absorb 3 to 4% more than the other. The person who absorbs 3 to 4% more had to be more careful than the one who does not absorb that well to keep the same body weight. I don't need to go into all the studies that are available for this. How many of you practice fasting? Ekadashi? 1, 2, 3. Good. Okay. Let me jump into that because I have only 5 minutes left. Okay. When you fast, certain biochemical and genetic changes take place in the body. Let me repeat. When you fast, certain genetic and biochemical changes take place in the body. Our grandmothers, great-grandmothers, they fasted on Ekadashi day, correct? In every religion, there is fasting habit. Christians, Jews, of course, Hindus, Muslims, they all fast. Somebody made a statement, the only thing all religions agree on is fasting is good. Otherwise they won't do that. Before I go to that, look at this study please. This is a very important one. The slide on the left is the body mass index and the incidence of diabetes prevalence. Non-vegetarian, semi-vegetarian, pesco-vegetarian, difference in the body mass index between the vegetarians and non-vegetarians. True? This is Adventist study of 60,000 people in the US. Diabetes, same way. Non-vegetarians are 3 times more likely to become a diabetic than vegetarians. Then you might ask, why is the epidemic so large in India? Because many of us are vegetarians. That's not true. Only 20% of Indians are vegetarian. Vegans and vegetarians had a 50% less incidence of diabetes compared to non-vegetarians, attributable to obesity. I don't have to go to the insulin physiology except to say some of you might know, that diabetes is not due to lack of insulin in the body. Correct? Diabetes, but there is insulin resistance. If nothing else, please take this message. Diabetes is not due to lack of insulin. Diabetes is due to insulin resistance. Except type 1 diabetes, it is due to insulin deficiency. This is a good slide from Kraft's pathology book. Insulin's job is to push the glucose into the cells. Compartment is full. The glucose is not going in even though there is insulin. So you get hyperglycemia, insulin resistance, metabolic syndrome, dyslipidemia, hypertension, heart disease because of insulin resistance. Fasting increases insulin sensitivity. Please listen to this carefully. You secrete insulin. Afternoon snack, insulin. Evening tea, insulin. Dinner, insulin. So never is the insulin coming down. When you drown somebody in something, they become resistant to it. Consistently high insulin leads to insulin resistance. If you fast, insulin comes down, the cells become sensitive to insulin. This again is the curve from Kraft's pathology. More than 70, 80 years ago, at that time he proved that diabetes is not due to insulin deficiency, it is due to insulin resistance. Cause of insulin resistance: hyperglycemia, hypertension, dyslipidemia, obesity, immunity, inflammatory markers, endothelial dysfunction, the leading cause of heart disease, and prothrombic state. All these are from that. Is India and diabetes, Pondicherry has the highest rate of diabetes, followed by Kerala of 25%. Throughout India, it is only 11%. So they have double the incidence of diabetes in the Malabar coast. This is for the diabetics, carbohydrate management, insulin carbohydrate ratio, less salt, increased fiber, foods with low glycemic index, and exercise should be the mainstay of treatment for diabetes. Same thing for a metabolic. About why we should fast. Here we go. There is a phenomenon called autophagy. Have you heard that name before, autophagy? Yeah, one or two. Auto means self, phagy means eating. We eat our own cells. When you fast, there is not enough ATP in the cells, not enough energy. So, the diseased cells are consumed by the healthy cells, which is a good thing. The average cell divides only 50 times, that's called the Halfic index. When once they divide 50 times, the cell becomes senescent, means it is functioning, it is alive but not functioning. This is called the diseased cell. The diseased cell is pro-inflammatory. It produces inflammation in the body. When you fast, the diseased cell is eaten by the healthy cell. Basically, you are recycling your own cells. There is less inflammation in the body, less prone to chronic diseases, less hypertension, less diabetes, less heart disease, by invoking autophagy. Professor Oshimi got a Nobel Prize in 2016 for proving in the lab that autophagy is healthy and fasting induces autophagy. This is 7 years ago. Your great-grandmother and my great-great, they knew fasting is healthy. Japanese fellow gets the Nobel Prize saying for proving in the lab why fasting is healthy. Upavasa. When we get an infection, they used to fast us. At least when I was growing up. 21-day fasting for typhoid fever. There is scientific evidence of that. During autophagy, after eating the diseased cells, body eats its own bacteria and viruses. Means the disease-producing organisms are consumed in autophagy. So that's a healthy habit to have. When you get sick, when you don't feel like eating, please don't eat. Okay, how often should we eat? Ek bhoje yogi, dvibhoje bhogi, tribhoje rogi, chaturbhoje drogi. Means eating somebody else's food. If you eat once, you are a yogi. You have good time, eat twice. 3 times eating, you are going to get sick. 4th time, you are eating from the neighbor's plate or somebody else's plate. Hindu monks fasted. Interestingly, I did not know until I started doing some research on the subject. Hippocrates, Plato, Socrates, Aristotle, and Galen, they all practiced intermittent fasting. I mean, they are no fools. They are the greatest philosophers of our time. Christianity, Judaism, Islam, Buddhism, Hindu, they all practice fasting. All religions agree that fasting is healthy. The only thing that all religions agree on. No fight on this. I think I will stop here to answer any questions that you might have. Well, let me complete this. 90% of us eat 4 meals a day. I'll go to the next one. Some of us eat for 15 hours a day. Means every waking time we are eating. Morning coffee, breakfast, lunch, afternoon snack, supper, and midnight snack. The only time we are not eating is when we are sleeping. I think I already mentioned this. The Hayflick index. Normal cells can divide only 40 to 60 times. They don't divide after they become sick. It's called senescence. Senescence is the loss of ability to divide but remain metabolically active but are not functionally active. These are the biochemical changes that take place in body with fasting and exercise. FOXO genes are stimulated, AMPK, NAD+, sirtuins. There's a whole lecture on biochemistry of lifestyle medicine, which maybe if time permits, some other day I'll be glad to come back and share this with you. I think I'll stop here. This is a good place to stop and to entertain any questions that you might have. Thank you. Very good. What does autophagy do? How do you induce autophagy? By fasting. Who fasted? Greek philosophers, Hindu monks, Christians, Muslims, Jews, everybody. All the religions agree fasting is good. Because is diabetes due to insulin resistance or insulin deficiency? How do you make cells insulin sensitive? Not eating too many times. You keep the insulin level down sometimes. How many steps a day we should walk? 10,000 steps. How many minutes per day? 30 minutes, at least 5 days a week. The only thing that has been proven to prevent dementia is exercise. What did I say? The only thing proven to prevent dementia is exercise. The incidence of dementia, you will still get demented, but about 30% less incidence of dementia in exercise. And omega-3, I didn't cover all, omega-3 fatty acids are healthy for the brain. That's called the Mediterranean diet. Any of you from OBGYN? Okay. The adverse pregnancy outcomes are less in those that practice lifestyle medicine than those who do not. That is exercise, diet. You have a healthy child with less adverse outcomes. How many times in a day should we eat? Oh. Intermittent fasting is not eating for 16 hours. That's what I do. My first meal will be lunch around 1 o'clock. Second meal around 7 to 8 p.m. unless I go for a party. Again, next meal around 12 to 1 o'clock. It takes 16 hours to induce autophagy. To have severe autophagy, you need to have 36, that is Ekadashi. Once in 2 weeks, if you practice fasting, you decrease the chances of becoming demented when you become 70 like us. Oh, I need to give one more statistic. There are 100 billion brain cells in us, correct? And 100 billion neurons. The 25 kilometers long, the neurons, put them end to end. We lose 0.2% of neurons per year after the age of 30. Means if you become like me, 70 years, 4 decades, I lost 10% of my brain cells. To make up for it, you have to improve the connectivity between the existing neurons. There is no way to prevent this, neuroplasticity or neurogenesis, except by practicing lifestyle medicine. Watch what you eat and exercise when you can. Minimum 10,000 steps a day. I did not talk about stress. There are 3 causes for stress. You know what they are? Okay, listen carefully. Worrying about the past. You have to repeat this, listen carefully. Worrying about the past. Uncertainty about the present. And anxiety about the future. What are they? So, live in the present. Don't worry about the past. Past is dead. Future is unborn. You can act only in whole meditation is just that. Mindfulness meditation means live in the present. If a question paper in front of you, oops, I wish I read this question last night. Hello? Last night is gone. Pay attention to the question there. Oh, what will come tomorrow? How do you know? Don't worry about the future. Forget the past, live in the present. You will be stress-free. What are the causes for stress? Very good. Thank you. Jai Hind.